So there are a number of challenges that would need to be overcome for reconsolidation-based approaches to be used as an addiction treatment. I would say the biggest challenge will be working out how to optimally make the memory unstable in each individual patient. Because in the rodent studies, the rodents have a very similar learning history, very similar drug experience, very similar extent of drug experience and age of drug memory. And we know that the strength of memory and the age of memory is quite important for determining how these memories become unstable. So you can imagine that in the clinical situation where you've got people who've had very different drug experiences and different lengths of addiction, that these factors obviously will be a lot more variable. So finding the underlying principles, sort of developing a better understanding of how we can optimally make those memories unstable so that we can then interfere with them pharmacologically, I think is going to be a major challenge. But a practical one rather than a theoretical one. And it's worth noting that there are some groups that have been trying to apply these reconsolidation-based approaches to human drug users. So there's the group of Ravi Das and Sanjeev Kamboy down at UCL, where they've been looking at hazardous drinkers, and they've had good effects using behavioural type therapies to update the Q alcohol memory. And there's also groups like Mike Saladin's over in the US, where they've been looking at cocaine memories as well and getting some good effects. But those are all very small scale studies, and obviously these would need to be expanded to much larger clinical trials before they could be rolled out to a more general use.